February is American Heart Month, and usually we associate our heart health maybe with our physical health, but there's research showing there's a really strong link between our heart health and our mental health. This morning, we're going to learn a little more with Dr. Luming Li. She's the Chief Medical Officer from the Harris Center. Dr. Li, good morning.
Good morning, Owen.
This is very interesting. I always think, wow, you are what you eat. We've heard a lot of the expressions, but is this kind of like you are how you feel, or how are we supposed to kind of interpret this?
Yeah, well, our bodies are all connected, right? And so one can't just separate the mind from everything else because when we have feelings, sometimes it generates stress and hormones and responses from the rest of our body. So for example, in anxiety, what we see is that people feel their heart beating really, really fast. And that can have some downstream consequences. Similarly, in post-traumatic stress disorder, our bodies are on hyperarousal, which means that they are so shaky and they remember things from the past and sometimes really traumatic experiences that really link together.
Yeah, so in some respects, a trauma from years ago is manifesting itself in a physical response.
Yes.
But it really lies in the mind somewhere.
Yes, and it's deeply connected because our bodies remember things. And what we do know is that in stress conditions, it's an abnormal reaction sometimes, or what we see is that there's a lot of tension in our bodies and we don't know how to release it sometimes. And where we go with that is our body recalls that and we're able to then go into this sort of hyper responsiveness, such as fight or flight. So if you think about it, our bodies normally do fight or flight if there's a bear out there, right? And what we know is that there might not always be a bear out there, but then we still respond to it. And then as a response, our heart is beating really fast, but it's not really what it should be doing.
Interesting. So we're putting excess stress on our hearts by the way we're feeling. So that would lead me to believe we need to get some help if we're feeling this. I guess the first step would be, how does somebody recognize that what I'm feeling isn't necessarily a normal response, or maybe it is normal, but it's too much?
Right.
How do we recognize that?
Yeah, so as I mentioned, if you're noticing that your heart is beating really fast and you're like, well, why is this happening?
Yeah.
It might be time to go see a physician to be able to check out, hey, is this something that's related to my heart, or is it potentially related to anxiety, which is a mental health condition, because the treatments are different for those.
What kinds of treatments are available for people feeling that way?
Yeah, so there's a number of different treatments out there. There's anti-anxiety medications, anti-depression medicines for depression, and then for PTSD, there's other types of therapies that are specifically targeting these conditions. And so it can be different treatments for different situations depending on your specific situation. So that's why it's really important to talk to a mental health professional to really determine what might be the downstream treatment.
What are some of the risks of not getting this treated, of just ignoring it?
Yeah, so what we do see is that some individuals, when they have depression, anxiety, PTSD, they tend to isolate more at home. There are some bad habits that develop. What we know is that tobacco use and alcohol use are common and sometimes comorbid, which means that they come together with depression and anxiety, and then the use of substances can be independent risk factors for heart decline and heart disease.
Is this something that can get out of control? In other words, it can just start with so often maybe we feel this heart palpitations, or however you describe the heart's beating fast, but then over time that can grow into other behaviors?
Yeah, for sure. What we recognize is, well, if you are starting to have it a little bit, right, that's a smaller symptom than if you're having it all the time and it's impacting your time with your family, it's impacting your ability to work. And so typically the way I describe it is, well, keep track of some of the symptoms, and then if you're noticing that it's really impacting the ability to work, or you spending quality time with your family, that might be time to then seek seek out some professional help to just get evaluated. There's no harm in getting evaluated to get a better sense and more clarity on what could be going on.
There shouldn't be at least any more stigma attached to reaching out for help. As sort of, I guess, as we illustrated with the Elmo tweet earlier today, it's like we should all be sort of okay to a degree opening up. We've talked a little bit about the risks of leaving it untreated. If someone wants to get help, if they're not sure, or maybe there's a friend or a family member where you say, hey, I've noticed something different. Is that okay to reach out and maybe helps a loved one?
Yeah, absolutely. What we do know is that there's a number of individuals, when you start to observe warning signs in your family members, it's important to talk about it and also start to ask for help. There are groups in the Houston area, including the National Association of Mental Illness, that can help get family members information about getting connected. We at the Harris Center also have resources for family members as well as individuals seeking out help. We have a 24/7 line that is operational all the time at 713-970-7000 that you can connect to be able to just get your questions answered and then know what to do next.
It's like taking that first step.
Exactly.
And that first step is very, very important. Dr. Luming Li, Chief Medical Officer from the Harris Center, really nice to meet you, and thanks for your time.
Nice to meet you.
Really appreciate it. I hope that helped y'all out there.